You're listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our Razorcast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Behzad Nazari. Dr. Nazari is the founder of Antoine Dental Center, a family dental practice with specialized dental services in Houston, Texas. He began his career as a registered pharmacist after graduating from Texas Southern University, and he then pursued dentistry and graduated with honors and a doctorate of dental surgery from the University of Texas at Houston. Dr. Nazari holds certificates in orthodontics, implant dentistry, and cosmetic dentistry. For over 15 years, Dr. Nazari has been serving generations, and he is widely considered to be one of the top dentists in the country, and he is also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, dental anxiety options. Hi, Dr. Nazari. How are you today?
I'm doing fine. How are you doing, Liz?
I'm doing great, thanks. So should patients do anything on their own to prepare for dental procedures?
Fear and anxiety about dental treatment or dental office or dentist is widespread, and regardless of the sex, physical size, or culture, this is it's a widespread phenomenon. We need to look at the etiology of the fear and anxiety, and one of them that can be that prior experiences from the childhood, or they are being influenced by media, by friends, or even by parents, or it can be because of our genes or our behavior. They will look at the situations. So patients would know that probably that are they on the spectrum of fear and anxiety? Where do they fall? Are they really dental phobic, or they are just have little anxiety? So if they know that they are really phobic about the dentistry, probably one of the things that they could do is one of the first things they could do is talk to one of their friends who has a good smile, and then they see dentists on a regular basis, talk to them, and then go with that person to his dentist or her dentist. That's one of the things they could do. And if they think that that's not enough for them, probably they need to seek consultation with like a therapist to overcome that fear that they have. If it's a simple anxiety, there are many methods that we suggest in our office for our patients that they can again talking to their friends and then coming with their friends to the office, and then also they can distract themselves. They can meditate. They can use relaxation techniques to prepare themselves for the dental office. And they can also, these days with the internet, they can go ahead and do research on the dental office of their choice that they want to go there, and they can look at the reviews and look at their website and what kind of procedures they perform, and the reviews are really helpful these days to calm them down, help them with the overcoming that fear.
Mm-hmm. Great. Okay. And please describe some of the comfort options or amenities you offer your patients when they come in.
Well, we go through training almost every week. All of us do. And the first thing that, we do in our office is that we make sure that everybody in the office smiles, regardless if we are on the phone or we are face-to-face with our patients. If any of our employees or the doctors, they are not smiling, we make sure that they smile. We have mirrors all over the office that you need to smile while you are talking to the patient, whether on the phone or face to face. And then when the patient, after they complete the registration form, we immediately give them a tour of the office, so they can familiarize themselves with the office, from the X-ray units all the way to where we do the sterilization, and then where the dental chairs are, who the doctors are, who are the employees who are going to be helping them. We have a tour guide. It's just like going to a museum. They go there, and then they get a complete tour of the office. That's the first thing that we do. And then we talk to them and we interview them for a few minutes to see that, what are they seeking, and then, what kind of personality they have, and what would make them, basically be comfortable. We offer them like things as simple as like a headphone with noise reductions. We offer them CDs, and if there is a music that they want to listen and we don't have them, we try to get them immediately through internet. We offer them like stress balls, pillows, blankets, and we have TVs in the rooms if they want to watch any favorite channel on TV. We do that to calm them down.
Great. And you offer sedation in your office. Is that available for any dental procedure, even a simple cleaning?
Yes, we do practice sedations. We offer sedation as simple as nitrous oxide or laughing gas, and also some oral medications, and also for the complex procedures, and the patient is very anxious about that, we do offer IV sedation also. And this is available for all of the patients for almost any procedures. In the past 15 plus years that I've been practicing, there have been a couple of cases that for a simple cleaning we had to use nitrous oxide. Other than that, we haven't had any patient that they have shown so much anxiety in taking X-rays or getting a simple cleaning done. But yes, they are available for any procedure for any patient. And also, just need to emphasize that we do get a complete medical history on the patient if any of the above sedation techniques is safe for the patient.
Okay, and the no lecture zone is a great term that you use to describe your approach. Can you tell us why that's important?
Yes, it is. Every person is different, and every person has a threshold, which is again, it can be the threshold on how strong you are, that how much weight you can lift, or what's your pain threshold, and what is your anxiety threshold. So everybody is different. So we don't judge people. We don't tell patients that hey, man up, or this is simple, or kids can get this done, things like those. We don't demean patients. We don't put them down. We try to understand. We understand them. We try our best to make sure that the patients are comfortable, and we listen to them. It's very, very important that the patient can be heard, and we don't judge them. There is no judgment in our voice, in our attitude, in our behavior that we approach the patients. And so they feel comfortable. We don't judge them because they are afraid, or we tell them that, hey, you know what, you need to man up, you need to get a grip on yourself. None of those. We don't try to lecture them. Everybody is different. And we evaluate them completely, and then based on that, we give them our evaluation or our recommendation.
Great. And how can we encourage children to see dental visits in a positive light?
Well, this is very, very important for the parents. If the parent himself or herself is anxious about dental visits, one of the no-nos is that never go to dentist with your kids. That's the first thing that you should not be. And also, do not talk about your anxiety in front of your kids. Just like, we learn languages from our parents, we learn the way that, about our food cuisine and anything else that, we learn from our parents, we pick up after our parents' anxieties also. Like myself, my father has always been afraid of snakes, and then since I was a kid, I was afraid from a snake also. So the same thing that when it happens, with dentistry and also the office to getting vaccinations or going to doctor's office. So never talk in front of your parents about your in front of your kids about your anxiety going to dentist. And if you're not very comfortable going it, that talk to your wife or your husband or your aunt and uncle. Let them take to your kid for their first visit in an office. And second is do good research on the dentist, that if they are good with kids, if they have pediatric dentists, that's what they do, that's all they are specialized in dentistry. And then also the first visit that you take the kids to the dentist, make sure it's just going to be like just a show, no treatment. They you take the kid to the office so the kid can get familiarized with the dental office, with the dentist, with the staff, and so they will not have that experience of the white coat or the X-rays or dental instruments that would frighten them. And also, it's very important that from the beginning, when the kid is born, within the 6 months or a year when the first tooth erupt, you take them to dentist so they can get used to going to dental office before they develop any fear and anxiety. And also that make sure that from beginning, from the first tooth that comes into the mouth, you start brushing and cleaning their teeth, so they would get used to proper hygiene.
All right. Well, that's all really, really great advice. Thank you so much, Dr. Nazari. We know you're extremely busy, so we just want to thank you for your time and help today.
Well, thank you for having me.
And for our listeners across the country, if you are interested in speaking with Dr. Behzad Nazari, you can either go online to www.antoinedentalcenter.com or call 713-364-8990 to schedule an appointment. And on behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.